The shoulder is a wonderful joint. It has a lot of degrees of motion. It does wonderful things for us, and it's mainly composed of ligaments and tendons and muscles. There's very little joint to the shoulder. So one of the problems that often happens is we can tear those ligaments or strain them or get them inflamed, and that creates conditions called rotator cuff syndrome or rotator cuff tears. And this is often a reason sometimes people go to surgery to repair tears of the shoulder and to improve the function of the shoulder from the rotator cuff. Unfortunately, some of those surgeries are not successful in totally relieving the pain and totally getting the patient back to their previous level of function. So what happened? People think, oh, the surgery didn't work. Well, often it's not a case that the surgery didn't work. The surgeon did what they were supposed to do. They went in and repaired the tear, but there may have been other injuries that can't be seen and can't be repaired with surgery. These things are stretched out ligaments, shoulder instability issues, chronic inflammation of a tendon, chronic imbalances of the muscles that hold the shoulder together. These are problems that are, first of all, different from a tear, and second of all, very amenable to treatment with some of the newer techniques of regenerative medicine using biologic products from your own body. And one of the most common ones we use is platelet-rich plasma. This is a treatment taking platelets out of your bloodstream and then using them to repair or to address an inflamed tendon, a ligament that's stretched out, a joint that's unstable, and muscles that are imbalanced. These are all conditions that are very treatable with platelet-rich plasma. So we can take somebody who maybe didn't have a great result from surgery and give them a much better result and a better chance of getting back to their sport, getting back to the activities that make them complete. There are other opportunities for intervening with shoulder pain using biological treatments. One of them is actually repairing rotator cuff tears with the use of stem cells. As long as the tendon is not separated, we can inject stem cells into that tear and stimulate the growth of the tendon and ligament tissue to actually heal that tear, and the patient, if successful, does not have to undergo shoulder surgery. This has advantages because, first of all, it's done right in the office, and it doesn't have any downtime. So sometimes surgery recuperation from a shoulder surgery is pretty time-consuming and difficult to get back. This is just an injection in the office under guidance where we take some stem cells out of your body, prepare them, and then put them right smack dab in that tear, which we find under ultrasound direction, and that can help heal that tear. In addition, some people are developing earlier and earlier actual degenerative disease of the shoulder joint itself, osteoarthritis. And the stem cells are very, very powerful in addressing osteoarthritis in the shoulder joint itself. So we have two uses for stem cells in the shoulder that are, again, saving people from surgical intervention in the first place.